Profound Conversations is a listening and dialogue space which brings foremost thought leaders into a conversation to grapple with the vexing challenges of today's world. Welcome to another episode of Profound Conversations.
Hello, everyone, and welcome to today's Profound Conversation. Today, we're going to be examining social determinants of health. We'll be dealing with violence and intellectually healthy conversational resolutions and seeing what we as a community can do together to, educate our community, as well as figure out are there strategies and things that we can be doing as well to be moving these conversations and actions forward. So just to share with you a little bit more background of what is a social determinant of health. Social determinants of health are things that have nothing to do with medicine, but still affect health. They're the conditions in which people are born, grow, work, live, and age, as well as the larger set of forces and systems that shape the conditions of daily life. So social factors, they have a big effect on health outcomes, especially for people who are the most at risk. And so when treating these groups, factors like education level, income level, and environment must be taken into account to improve health outcomes. Income may be the most important social factor that affects health. We've all seen too many patients in times where folks who couldn't afford their medicines, a healthy diet, or a good place to live, and it hurt or adversely affected their health. And also today we'll be speaking about violence. Violence in Black communities also has a big effect on how people's health turns out. Gun violence and other terrible crimes happen. It's something that plagues not only the region that some of us are here in, Washington, D.C. and Baltimore, but many other cities across the United States. As if that's not enough, these same communities are then left with the difficult, confusing, and existential task of figuring out what the root causes of these behaviors are. Often, these things go without good answers. And in addition to that, we have to then face the sad fact that law enforcement has been a problem for many years in these same communities for a long time. So the goal of today's episode is to engage in a conversation about these problems with social determinants of life by talking to grassroots change makers and mental health professionals about what they see can be done and what their organizations are doing to help change our communities that are under attack. So ladies and gentlemen, it is my pleasure to introduce our guest for today. Please help me welcome as I introduce Dr. Pamela Brewer, who is a highly accomplished clinical social worker and mental health advocate. Dr. Brewer has been recognized for her pioneering work in the development and dissemination of mental health and relationship awareness programming, receiving the Distinguished Alumni Award from New York University Silver School of Social Work in 2016, and with over 30 years of postgraduate clinical experience, Dr. Brewer is a board-certified licensed clinical social worker and holds a PhD in social psychology. So you need to know who you're talking to today or who's talking to you. And she holds this from the Union Institute and University. So in addition to her extensive clinical work, Dr. Brewer has also served as a field instructor at several prestigious institutions that include Brooklyn College Women's Center, the University of Maryland School of Social Work, Law and Clinic, as well as George Mason University School of Social Work. Also, help me in welcoming Greg Jackson, a prominent community organizer, political strategist, and issue advocate who currently serves as the executive director of the Community Justice Action Fund. Prior to assuming this position, Greg led the organization's national advocacy efforts for 2 years, working closely with elected officials, community leaders, and impacted residents to promote proactive and preventive solutions to end gun violence. As a survivor of gun violence himself, Greg has a deeply personal connection to this issue and has been a leading voice in advocating for gun violence prevention measures for Black and Brown communities. And then he's also a distinguished alumni of my alma mater, the University of Virginia. So wahoo, thank you for joining us today. So everybody, please welcome Dr. Brewer and Greg Jackson today. So To both of you, I just wanted to ask this question as we just jump right in. If you would like, please, just explain to us from your point of view, what are social determinants of health and how do they affect health outcomes, especially for vulnerable groups, as far as you see?
I'll start. From my perspective, social determinants not only include your physical environment, but your emotional environment, absolutely, your financial way in the world is important, your educational experiences, your medical experiences. One of the things that I think is important for us to continually acknowledge is that even if we find that we have some sort of financial stability, that doesn't mean you're going to be treated the same way somebody who looks differently is going to be treated. And so we have to be clear about that. I think we have to be clear about the impact of expectations. So all of these are part of, from my perspective, social determinants. If you're living in a space where you are taught to think more or less of yourself over time, unfortunately, you can buy into that myth. This will have a tremendous impact on not only your emotional health, but your physical health as well. Greg?
Yeah, I think the only thing I would add there is, there are real risk factors that need to be considered too. And that's, how much an individual is exposed to other negative health outcomes, whether that is violence or other forms of trauma, is a huge determinant of their health outcome. And then frankly, what do they have access to? Do they have access to a quality education and stable housing? Do they have access to mental health resources and therapeutic support and conflict resolution? Or frankly, do they have access to struggle? Do they have access to firearms? Do they have access to drugs and alcohol? What is in front of them in their communities as they're trying to navigate through life to ultimately reach their goals? And that's a big challenge we see with gun violence, is where when dealing with conflict, there's more access to things that cause harm than those that can help de-escalate or help folks navigate through a conflict.
Absolutely. Thank you for that. And, just hearing the two of you talk about that, one of the reasons why this conversation is just so important for me is, there were a number of years where I actually got to spend some time living in West Baltimore in an area called Edmondson Village. And if you're familiar with the Baltimore area at all and you hear that name, folks know that that's not, not one of the best areas in Baltimore to be. And I remember spending that time, with a number of folks who were in the community. And I was amazed at how many people did not know how to read. They would save your phone number with the alphabet because they couldn't text message. And they would, they'd have conversations with me to say, we don't have the education. We don't have access. They would call me Nick. They say, when you leave the community, you have to speak for us because they don't, people don't listen to us. We're not articulate enough, but you're educated and you've been there. So please tell our story, share what's happening here when you get that opportunity. And so you're absolutely right with that, but and it amazed me how many of the young people did not expect to live beyond 20 years old. And they would tell me, if you work in these communities and you don't get the children by the time they're out of middle school, they're gone. And I was just amazed. But if I had not had the opportunity to live in that community for a while and get to know the people there, I would have never known that it was to that extent, when you get to listen and hear these stories. So, it's so important that we're having this conversation. And thank you all so much again, for your contribution. And so as we continue, Dr. Brewer, I know sometimes you even talk about we talked a little bit earlier about, the violence, and I know Greg will go into that more as well. But if we segue over into that, Dr. Brewer, I've heard you say in the past, you speak of like emotional violence, a lot of times that these communities are dealing with. Could you speak a little bit more to that, when it comes to that, and what communities of colors, what can we do to have a sense of strength, I guess, moving forward?
One of the things about emotional violence is that it's so incredibly pervasive. And I'm not sure that we all the time have a sense of what really what's really going on. If I'm yelling and screaming and cursing at you, or if I'm being yelled and screamed and cursed at, that's a violent interaction. I'm not going to listen because I'm trying to protect myself. And in trying to protect myself, I'm going to hear what I hear. It may not be what you're saying, but it really might be what you're saying. If you're yelling, screaming, you're calling me names, you're telling me how much I'm not worth. If you're telling me how much I can't do, if you're telling me how wrong I am just walking down the street, that's violence from my perspective. When you think about violence, when you think about physical violence, and certainly, Greg, I know you can speak to this. Unfortunately, I think we can all speak to this. You can walk down the street, and if you get a certain kind of look, you don't know whether or not you don't know what's coming after that look. You have no idea. For many years, I lived in New York, and then I left. And at least when I was in New York, if you looked at somebody, if you looked at them halfway crooked, you could be a victim of physical violence. But then it was a sense of you're being harmed, but somehow it's your fault. We're really good at blaming the victim. So those are all of the pieces, I think, of emotional violence. If you go to a medical doctor or any kind of clinician and they treat you based on what they expect you to be, that's violent, because that's limiting your emotional, intellectual, and social lifespan. I could go on forever, but I think I'll stop.
Yeah, I just, it's, I think there's also a bit of emotional violence that comes from the stereotypes that are painted on us. There's a very dominant stereotype that as Black men, we are already, likely to commit a criminal offense or physically harm someone or be a threat. And that steals a lot of your joy, and it steals a lot of your personality, out of life. When you're a kid, you're taught not to smile because that's soft or weak or not manly, right? And you're taught to absorb pain and deliver pain and not process and navigate through it or around it. And then when you go out into the real world, you see it reinforced through television and media more first and foremost, but then echoed by entertainment, echoed by music, echoed by movies and sports, even sports, frankly. I mean, we're looking at what happened with John Morant recently, someone who came from a 2-parent household, very privileged upbringing, an amazing athlete making millions of dollars, but still feels the need, to put on that show, to show his manhood or to show what's considered manly in our culture. And it's a tragedy, but that stuff weighs down. And what Ms. Brewer said earlier, I mean, when you're told you are something long enough, you start to believe it, and you start to realize, hey, let me figure out how I show up as a version of this stereotype that America just reinforces at every corner. And a lot of the violent outcomes we see, I think, are based on fear and trauma, but we've also normalized what type of behavior, especially Black men and Black children, should be they should be exuding when they deal with conflict or they deal with someone side-eyeing. I always had like a little experiment in my neighborhood. I speak to everybody, and I say, good morning, what's up, y'all, how y'all doing? And they're always shocked, one, and I just kind of smile like to disarm them, like, oh, and then once you break through that, you have a normal conversation with someone who, you never knew how tough their day was, and they had this very hard exterior because that's what the world told them they need to be. But on the inside, they're a person just like me. And frankly, they might have had the same stereotypes looking at me walking up as I did to them. And I think we have to figure out how to break that down, because America's kind of creating this cultural violence in its own way that causes a lot of emotional harm, too.
One of the things that is clear to me is how we even think about reaching out for help, for resources. And, I'll take this back to the beginning of my clinical training. And the deal was that depending on how, nobody said it because that's not clinically appropriate, but the deal was depending on what you looked like and how you spoke, that was a determinant with respect to how you were going to be treated, how you were going to be diagnosed. For folks of color, even going in for treatment, particularly mental health treatment, that's not something that we do. And, I've said this many times too. At the beginning of my practice, I figured I'm an African American therapist. This is going to be really cool. I'm going to have all these Black people talking to me. Wrong. The majority of my practice for so many years was white women. White women, bless their hearts, had a lot of support for getting help, for seeing a therapist. Black women, not so much. And Black men, not at all.
Yeah, it just seems like it's this gross misnomer, that if we speak to a therapist or a counselor, one, we're not supposed to tell our business, right? Anything that happens in our houses have to stay that way, But then also there's this stereotype that in our community that if you see a therapist, there must be something mentally wrong with you, And I oftentimes when I talk to people about receiving therapeutic care is I feel like our brain is pretty much the most or one of the most, I'm sure you'd agree, important organs that we have, but it seems to be the one that we invest in the least. Seems to be, behavioral health seems to be a space where the government does not invest a ton of money in, and it's been something that I know in my family, we've had a number of family members who've had these challenges as well. And it's been really, really tough. You just feel like no one cares, about you, your family, what you're dealing with. But oftentimes they're so quick to throw us under the jail, if anything happens. But usually prior to some things happening, families are crying help. People are yelling help. It's not something that just shows up here. And so, what are you finding as well when we talk about these things are, just some of the challenges that, we as a people are dealing with when it comes to receiving like proactive behavioral health care or, those various resources that, you see that our counterparts have immediate access to?
One of the things is that certainly from an insurance industry perspective, mental health, behavioral health is at the bottom of the totem pole. So if you've got insurance, you've got to go through all kinds of hoops to access behavioral benefits in a way that's really different from, if you're going to a podiatrist because your toe hurts, that's not a problem. If you have a heart condition, it's a problem, but it's not a problem in terms of getting care. So the sense that there's so much of the world that minimizes the impact of it is part of the problem. Years ago, I did a radio show with talking about macular degeneration. And so I interviewed a lot of ophthalmologists, and they very clearly said to me, if their patient had macular degeneration, they weren't going to tell them. Now, this patient was losing his or her eyesight, but if they couldn't fix it, they weren't going to talk about it. That has changed significantly. But that's kind of scary. If you can't fix it, if you can't change it, well, just sit back and let it happen. And I think for us, when we're taught that our life is what it is, because we created it, we made it that way, we deserve it. So we're taught that it can't be fixed because it's just sort of part of our DNA. That's a lot of impetus not to seek help, because what's the point? What's easier is to pick up a weapon because that's an immediate reaction. What's easier is to get into a fight or to threaten somebody because that's powerful. We're taught this stuff so often, almost from day one.
Yeah, and I think, I think we also don't quite, I think there's two other big challenges. One is that it's just not accessible at all. Even if you're having a breakdown, whether, I spent my childhood in rural Virginia. We didn't know where to find a therapist to save our life. And right now I live in Southeast Washington, D.C., in a neighborhood that's dealt with a long history of violence. And we still can't find therapists, and the way therapists and practices are structured, because, a lot of it, is follow the money. They're where their clients are. And the clients are, frankly, where the money is. And because it's kind of something that's a benefit or a luxury for privileged individuals. And so even if I had the money to go to therapy physically, I have to travel across town 25, 30 minutes just to get there. And that makes sense for someone who has resources and who maybe really is prioritizing it. But that's a huge barrier in itself. And then when I do go, what do I get? I'll never forget when I was in Buffalo after the mass shooting. We had, a couple of days after, we had a vigil, and you saw hundreds of people who were grieving. That had lost family, had lost friends, had lost neighbors, and there was four grief counselors there. Two young white girls fresh out of college, and two older Black women, and you have hundreds of people that are in need of grief support. And they were not only overwhelmed, but unequipped to even deal with that many people, for one. And for two, they didn't even have the tools on how to support people. And so there's just a huge barrier physically, and there's a vast shortage in enough people to even support those who are in grieving, which is really, I think, probably the most intense phase of the need for therapeutic support. And then on top of that, I think one other thing is we always look at, go to the doctor when you're hurt, not go to the doctor when you're exposed or maybe there's a risk. And with violence, especially, so many of us are exposed to violence, whether it's watching a shooting on our social media or learning about a cousin that was harmed or killed. And when we're exposed, we're not taught that, you should actually go talk to someone to help you process it. We're taught that, it's not until you get shot or until you lose a family member or until you physically see something that maybe you should think about some help. And I think we have to figure out, how do we get people to proactively engage and seek out mental wellness resources when they've been exposed, and not just when they've been physically harmed or physically impacted.
Absolutely. And so, you bring up a good point there, Greg, and that's a question that I have for you all from, even what you're seeing on the ground level, right? What are ways that, just even we as a community, how can we better integrate mental health into our healthcare or health services? There may be resources that many of us may not even know are available. How do people even find out about behavioral health or therapy? If some folks are maybe hearing about it, but maybe this might be their first time saying, you know what, they're absolutely right. There is nothing wrong with me. I need to look into this and see how I can help myself or my family members.
Yeah, I think I'm sorry, I'll jump in first. I think the way that we do it, especially when it comes to issues like gun violence, is we have to meet people where they are. We can't expect them to get in the car and a train and go sit down on a couch in an office. We have to figure out, how do we bring these tools and resources to the communities where they are, where they're already comfortable, and start to give them at least some of the basic support. And there are programs across the country that are starting to do this and are seeing great success. Organizations like Life Camp, they have the Peace Mobile, which is a big bus, frankly. And on that bus, they have massage therapists, they have mental clinical therapists, mental health therapists. They even do sound baths. And after something tragic happens in a neighborhood in Queens, New York, they will literally pull the bus up and provide services for everyone in that space. Everyone who's been impacted, no matter what, why, or how, just here it is. Come get a massage, come relax. Here's a sound bath. Here's even nasal therapy, just anything that you need to help you navigate through this tough moment is right here. And even with street violence intervention programs or community violence intervention programs, we're training credible messengers. We're training people that live in these buildings, that live in these homes and neighborhoods, therapeutic strategies and how to cognitive behavioral therapy approaches and trauma-informed conflict resolution skills. We're training them and then sending them back into their neighborhoods so they can de-escalate conflicts, at 2 a.m. when people are arguing after drinking, or, in their living room, when their neighbor, hears them, maybe they can call a specialist to come in and help de-escalate the conflict. But we're bringing these types of approaches right into the communities that need it most versus, frankly, kind of the old school westernized approach of come visit me for help. It's like, no, we're putting the resources where the need is. And I think that's kind of what we have to do more of if we really want to see the results, especially in communities that are worse off.
One of the things I would also talk about is the need for people who are setting out to help to really help identify what is defined as help for the individual. and what is a reasonable expectation after the quote unquote help has been delivered. I'll just speak to the mental health piece. There are people who will say, well, I've got 5 visits, and so if I'm not well after 5 visits, there's something wrong with me. Well, first of all, that's not true. And second of all, what does well look like? Again, for me, I think it goes back to the social expectation, the difference in the social expectations of us. If I go see a therapist and my expectation is that at the end of X number of days or weeks, I'm going to not be mad, not be sad. I will have forgotten the trauma. I will forgive my abuser, and not only forgive them, but go to dinner with them. At the end of that period of time, I will have failed from that perspective. But if at the end of that time, I'm able to acknowledge that I'm mad, I'm sad, I'm hurt, I'm scared, but I'm here, and here are the ways that I keep myself here, that's wealth from my perspective, that's strength, and that help, that can sort of have a snowball effect in the community when you get to realize that you're human just like everybody else, and your quote unquote recovery, in a lot of ways it's on your time. It's got to be on your time. You can't have somebody saying, you've been here for 10 minutes or you've had, 2 hours of massage, so now you're well. And if you're not, again, what does well look like? If you're not, quote unquote, well, then there's something wrong with you. Not that there's something wrong with me as a provider. It's not that I came to you with my own biases, and that there's something wrong with you. That's got to change.
Absolutely. And, I know one thing, even when I, talk to my therapist, and I'm so grateful for my therapist during some of our first conversations, one thing that at the time she reassured me, as we began to identify triggers and traumas, I said, I've just got to get these triggers to go away, and she said, well, let me help you with something. Your triggers are always there. They're going to be there, right? You've got good triggers where you smell something good and it brings up good emotions, and then you've got negative triggers at any time that happens, it brings up, those negative emotions. Those things that trigger you, you're always going to have to deal with that, right? Because it happened. She said, however, what you're here to do is to, like you said, learn to process it and to create the tools for yourself, that in those moments, you have tools or just thoughts or questions you can ask yourself before you react to something. You can have more control over how you respond to it as opposed to an emotional reaction. So I wanted to share that as well, because like you said, sometimes people think if I don't have it all together after my 5 visits, something's wrong with me. I'm learning it's a lifelong process, just lifelong uncovering of the things sometimes that we don't even see, that really upset us or make us react and respond to certain things the way we do.
And I think also in our community, and for a long time it made complete sense, maybe now less so, it wasn't okay to be emotional. Emotional was a dirty word. And if we were emotional, then there was weakness. Then there meant you couldn't cope. Well, everybody's emotional, assuming they're not a robot. So you're normal if you have emotions. I worry if you sit in front of me and everything's all good. You're fine. No problem. Everything's great. That's when I worry. Not when you're expressing a range of emotions that are maybe uncomfortable, but they're true. They're real. They're
Absolutely.
yours.
And so, I know we've spent some time dealing with, the therapeutic care and behavioral health side of things. And Greg, I wanted to pivot here for a moment just to dive a bit deeper even into gun violence, and really, as we've talked about these various communities and being able to find support within the community for us to be proactive, support and help ourselves, and then how to grieve together. But, for yourself, being a survivor of gun violence and now an activist, when it comes to, systemically what you see that these communities are also dealing with, can you speak to that, whether it's your experience or what you're seeing that, communities are dealing with systemically, and even, are there things that we can do, to to support, I guess, politicians or people who want to lead in their communities to help change some of these laws or law enforcement? And I know it's kind of loaded, but whatever comes to mind, in those questions that I've asked, can you please speak to that?
Yeah. Well, I think when it comes to gun violence, America's gotten it all wrong for a long time. We have thought that, hey, the way that we deal with the criminals is get them off the streets or get the guns out of the hands of the bad guy. And we've been applying that approach for now decades, and it's only getting worse. And communities and states that have the highest incarceration rate still have the highest levels of gun violence, places like Louisiana, for example. And what we at Community Justice strongly believe is that the reason we're failing in this approach is because we're trying to take a crime control approach to what is really a public health crisis. And every time we take a crime control approach to a public health crisis, it's a disaster. I mean, we saw it with the crack epidemic, where we saw huge waves of mass incarceration that did it slow down the usage of crack? Maybe, but that's because you incarcerated, a huge percentage of our population. So you lowered the use of anything, food, water, and everything. And I think it just really disrupted us, and created a huge ripple that we're still struggling with. And so as we think about solutions, the biggest thing is we have to first push back on that narrative that we have to just solve the crime and get the bad guy, and realize that, one, the people that are causing violence in our communities, one, it's a very small population. And two, the majority of them were victimized first. And so we're dealing with traumatized individuals, not necessarily criminal individuals. And the data backs that up. 70% of homicides in the Black community are not connected to another felony. And 89% of homicides in the Black community are not connected to gang activity. But if you look at the news, if you look at the policy responses and debates, it's all about, you see yellow tape and blue and red lights for every 5 o'clock when a shooting happens. All you see is police imagery. And every debate politicians have is, should we fund the police or defund the police? And what is our new law, our regulations and our permitting and our sentencing, and who should have the gun? Should we ban this and ban that? And again, we're just totally off base because we're not thinking about the people and the resources they need to recover. So I think the way that we really can change this is, one, starting with victims, thinking about what happens when someone is victimized by gun violence, and taking a strong look at what resources are we providing for them. Right now in America, the only thing we offer across the country is victims compensation, which is basically a reimbursement fund to help you pay for any financial costs. But that's only if you work with law enforcement. You have to get that from law enforcement. And we found that there are so many barriers for these dollars that in the state of New York, only 4% of victims are even getting those funds. So we're not even financially supporting victims of gun violence, let alone therapy, housing, protective services, relocation, legal support. The rest of the support that someone needs when they're victimized is almost impossible if they can't even get financial assistance in an equitable way. And so we have to figure out, one, how do we do better by survivors, recognizing that the survivor who doesn't recover in a healthy way will be the next shooter. It's almost automatic. Then from there, we have to think about, okay, what's the next layer of people who've been traumatized? And typically that's family members, that's community members, that's best friends from high school, the guy who lived in the built house next door. They used to play ball together. And what are we doing to make sure that they are getting the resources they need to process that trauma, especially if they lose someone, and help them figure out how to handle that conflict without creating future harm. And then that's where like street intervention and community-based violence intervention, hospital intervention programs come into play. And then the next layer from that is, how do we work with those who already have a violent past? So that kid who was bullying and got kicked out of school. I was listening to an interview with Jonathan Majors from Creed and Quantum Mania. I mean, he got kicked out of school 6 times for fighting. And really what saved his life was someone who pulled him out and said, look, you're very charismatic. Let's put you in this program and see if you can use that energy in acting. And now he's one of the biggest, fastest rising actors in America. But that's the same kid that could have become a shooter if they didn't have the resources and support, and no one had pulled him out of that situation. And so there's so much talent in those at risk or or promising individuals, but we're not pouring into them. We're just waiting for them to make a big enough mistake to incarcerate them. And so I think just starting there is really important. And then from there, we can start thinking about, okay, what are these larger systemic things we can do to reduce the number of folks who are at risk? And that's when we can start looking at our education system and looking at our housing stability, and then also looking at the real risk factors, which is access to firearms and magazines and the certain types of weapons people get. But it's before we even start thinking about the supply of resources that people have to harm each other, aka guns, we need to first think about, why are people demanding them? What are we doing to reduce that? And then it makes it a much simpler path to eradicate this crisis of gun violence. And that's what a public health approach is, starting with the people and then working your way out and dealing with the different factors that led to that harm between people. And so if we can systemically flip things from crime to public health in the eyes of our legislators, our media, our journalists, our neighbors, our friends, our parents, our teachers, then we can start getting closer to some real solutions. And frankly, I think America has solved way more complex problems before. This is actually easy for us to fix if we actually look at it the right way compared to other public health crises.
Absolutely. And, there's some statistics that I've heard you share before, and I know you shared it even before Congress, because, we can talk about it or talk around it, but it wasn't until I actually heard the numbers come out of your mouth of what this pandemic in our community looked like. And so if you don't mind, can you share what I'm talking about of the research of what you all have found in the statistics? How our communities are being affected by gun violence?
No, I mean, this is the number one health crisis for our people. There's no doubt about it. I mean, this is the leading premature cause of death for all Black men, the number one cause of premature death for all youth, and that's Black, white, green, whatever. And that's more of a recent thing for American youth, but for Black youth, it's been that way since 2006. Right. And we're thinking about car accidents and drugs, and we're thinking about all this other stuff, alcohol access and all this. But no. Gun related deaths is what's taking our babies away. Number two cause of premature death for Black women is gun violence. Right. And so it's one of those things where it's right in our face. And what we've seen is that a lot of even our social justice and civil rights groups and our elected officials, again, they're just seeing it from a crime control approach. So they're getting further and further away from the solutions, despite how bad it is. And I shared this earlier, 70% of our homicides are not connected to another felony crime. And so what that tells us is that even in times like when COVID-19 hit, since 2019, we've seen most forms of crime make a nosedive, right? Because we're in our homes, we're not in schools, we're isolated. But we saw a huge spike in gun violence. We saw a 35% increase in homicides for all communities, 39% increase in homicides for Black folks, and 172% increase in teen homicide since 2019. While all other forms of crime have decreased, at least until recently, some are starting to spike back up. And so when you have it directly contrasting each other, it's like it's right in your face. Like, this is more than crime. And if we had the most perfect crime control approach in the world, we would still have 70% of these deaths, and these would still be a leading cause of death for our folks. And so the writing's on the wall that we need to start looking at, what are the health-based strategies? What are the community-based strategies? What are the education-based strategies? What can we do to help make behavioral shifts and changes, and not just, hey, let's lock up the bad guys? Because it's getting crazy. I mean, in Chicago, for example, there was a study done by Duke Law that looked at the incarceration rates, and they're starting to get back to the 90s levels because they're incarcerating everyone who has a firearm, even if they don't have a violence offense, even if they don't have the intent to harm someone else, they're locking them all up because they can't even solve the homicides. In cities like Chicago, we're seeing the homicide closure rates are between 40 and 60%. So even when someone is harmed, only half of the cases are even getting closed. And so we're watching a legal system becoming desperate and panicking. And what they're doing is they're locking us all up, and they're destroying future families and future homes and future leaders and communities. And unfortunately, a lot of our leaders and a lot of folks that some of us look up to are complicit in that. And we've got to figure out how to disrupt it before it wipes us out, frankly.
Yeah. And, even just thinking about that, like that has a direct health impact on our future, the future of our community, the future of our children are our future. And so it's, with so many deaths happening, at the hand of gun violence, and then so many incarcerations. I mean, who's going to be left, for our future, for our community, how is that going to look? And so I know you said some things even systemically here, like, even statistically, I guess, what is your organization seeing even in the racial divide when it comes to, resources, income, even just how government officials respond to things, depending on what community these things are, or events are taking place.
Yeah, I mean, there's a huge discrepancy. And what's interesting is look at the news coverage for any mass shooting. And you'll see, what do they first say? Oh, well, this person had a mental health breakdown, right? And they'll say, well, he was a good kid. He just was having a rough time. And you may learn all about what soccer team he was on before he went and got his gun with his dad to go hunting. And then he turned around and slaughtered all these people. And I think what we're seeing is, just from a narrative perspective, there's already a very big difference in how they paint the picture. In white America, they already see it as a mental health crisis. And so with most of these mass shootings, they're looking at hardware solutions, but also mental health strategies. But with us, it's purely a crime control approach. And so the first thing I think we're seeing a discrepancy is the narrative and the type of strategies that are being prioritized. Secondly, when we look at this, frankly, the research is another huge disparity. Of the top 30 leading causes of death in America, this is the least researched. And so there's way more research on tuberculosis and all these other diseases and challenges out there that our people are facing. But it's laughable how much is going into gun violence specifically. So we don't even have enough research to know which solutions beyond what activists like myself are pushing for. There's not even research to even say they work or don't work, right? And then from there, when we look at what communities need, we have a huge epidemic where academics are prescribing solutions for Black and brown communities and not actually listening to them, listening to survivors and our folks. And so that's frankly where the breakdown is happening too, where we're seeing in a lot of major cities, these very aggressive sentencing increases, crime control strategies, huge surges in police budgets and police surveillance, programs like Spot Shotter, where they're putting millions, if not billions of dollars into surveillance of communities to see when the shots happen so they can get there faster. And these type of prescribed solutions in a lot of ways are doing harm, but frankly, they're just missing the moment when we could really be putting those millions of dollars into working with those at-risk individuals and have much higher outcomes and much better outcomes. And so I think that's another huge discrepancy is we're seeing in our communities, dollars are being poured into surveillance and patrolling as opposed to investing in programs and resources that we know can deal with the behavioral challenges that lead to a violent conflict. And that's not the same, in white communities, frankly. And so I think those are just a few examples, but a lot of it really kind of comes back to this perspective that Black and brown folks are a risk to each other versus, a criminal risk versus folks who are dealing with the same level of trauma and wellness challenges that the other individuals are when they are involved with the violence.
Thank you for that. But, even Greg, when I was hearing what you were saying, and Dr. Brewer, I don't know if maybe you can speak to this, it was something that you were saying earlier. You were just saying when people are told over time that they're not important and, all of these things are happening, it's like the system is telling us this. And so when you look at this overall, because we have organizations like Greg's organization and, we have folks who are grassroots who are trying to get into the communities, yet there's so many things happening where, we're trying to help ourselves do the best that we can. And sometimes it still seems like things are getting worse, or from where I am, so from your view as a professional, what is your prognosis? Like what What do you see is happening here? Are we getting better? Are we not getting better and going in the wrong direction? Are we going in the right direction? I mean, and we may not even have the answer, but even from what you can see, I mean, what would you say? How would you speak to this?
One of the things that I will say is that more and more men's groups are forming so that they can talk. More and more women's groups are forming. There's more of a commitment to teaching children how to non-violently interact with each other, how to express, what's going on with them. So from that perspective, I think things are improving, and they have the potential to improve even more. The other side of that, though, is that, when a large body of people start to behave in ways that another body of people don't expect, they get scared, because now it's not predictable in the way that they thought it was. Now they don't have the power to create the vacuum that for many people works for them. And then I think that's when things like January 6th happen. And what was one of the things that was interesting about January 6th, right? Look at all those people who were storming the Capitol, and look at what they look like, and look at how long it took for anybody to show up, and look at how many people survived that. I'm not even sure I'm exaggerating if I said 2 Black people walking up the Capitol who looked like they might have had a gun in their pocket maybe yesterday, they wouldn't even be around. That's sort of an exaggeration, but in a lot of ways it's really not. I think another thing that will create more improvement, and I think is happening, but we really have to work at it, is how we listen to each other. How we listen to each other, and then how we allow other people to listen to us. If I'm listening to you to make sure that you agree with what I'm saying, I'm not hearing anything you say. And so I'm expecting you to be the mirror image of me, and if you're not, then there's something wrong. The power of being heard is enormous, particularly for people who've spent their lifetimes not being heard, being told how they are, who they are, where they go. And just in terms of the reporting of the violence, you kind of know within 30 seconds, I'll stretch it, within 60 seconds of a news report about something, you probably already know whether the person is Black or white. Not because the person is Black or white, but because of how the media is treating it. Whose faces are going up, whose faces are not. And as Greg, as you said, who are we looking at the history of, and who are we saying, they just need to be thrown away. They weren't all that great to begin with. Let's just throw them away quicker, faster. Yes, I see change, but I think a lot of people are afraid of the change.
Mm-hmm. And I will say, too, from a political standpoint, we're seeing a lot of progress right now. And I think it's going to take time for that progress for people to feel it. And right now, the violence itself is still surging as a lot of these movements are changing. But just this week, President Biden announced another series of executive actions around gun violence. From our count, this is his 4th set of executive actions on gun violence, which is more than any president in history. And he's focused on everything from reentry programs to youth violence reduction to holding the gun industry accountable, to putting pressure on the government to do more for survivors, funding for violence intervention. I mean, across the gambit, he's been focused on addressing this crisis in a lot of ways that will save, Black and brown lives. And that's huge. And there's been a huge ripple from that. We've seen governors and mayors all over the country. We're seeing Republican leaders stepping up and starting to think about solutions and what they can do and how they can be a part of change. Last year, we passed the first gun violence prevention bill in 30 years, the Bipartisan Safer Communities Act, which Republicans and Democrats work together on strategies, all of which are very, very positive and moving forward. And so we're watching a real shift in political focus on this issue. And I think a lot of that, frankly, part of it is, yes, people are seeing in the media, but they've been seeing it in the media. I think the real difference is that there are a lot of survivors who are just fed. They're not going to sit down and just accept, thoughts and prayers. Like, they're pushing for change and they're fighting for change. The survivors in Uvalde, they have created a movement. They've had 4 press conferences in front of the governor's office and the legislature in Texas. The leaders in Buffalo, after the mass shooting there, they've started to build their own Black-owned grocery store. They're doing a big conference in May. Like, they've been to the White House putting pressure on the president, introducing the president, but raising hell at the same time. And so we're seeing people who have been harmed not just accepting that they're victims, but stepping up and being fighters, and I'm proud to be one of those, as a survivor of gun violence myself, and we have to realize that there's so much power in the people who have been impacted. And we're starting to see that, as opposed to retaliating on that individual, pouring that energy into changing things, for the better and retaliating against the oppression. And so that's something I think is exciting and encouraging. And I feel like, it's darkest before dawn, right? And so we're still in that dark period, but I do feel like dawn is close.
And just to speak a little bit more on that, Greg, earlier I had spoken about, speaking with members of the community who, could not read or could not write a letter to a politician or anything like that. And you had mentioned something about, being able to get involved in things. Can you speak a little bit deeper to that around what can people get involved, especially for folks who may have been victimized, but they can't write a letter to their politician because they may not know how? What are other ways and avenues for them to be able to get involved, to fight for themselves and to make sure their voice is heard, although they may not be able to, articulate that in script themselves?
Yeah, no, I think that's a real question. I always say vote with your feet, just pull up on people. If there's a budget meeting and your neighborhood is all there, it's pretty hard for them to say, we're not going to put money into your neighborhood if y'all right there. And it doesn't, change doesn't take a lot of people. It just takes a few brave people. When we started putting pressure on the Maryland legislature, it started with a group of 5 of us, and we fought and got, I think, $3.6 million for violence prevention, and that was five people, just telling our stories. And, you don't have to know the bill and the legislation, but you can tell your story, and your story is powerful, and your ideas and solutions are frankly way better than a lot of the academics sitting in there, at their desks, at their laptops, reading a million books, because you've lived it, you've seen it, why that person caused harm, why your cousin or family or friend was in the mix in that moment. And so telling your story is really important. I think also, making sure that you're just doing what you can to support people in your community that have been harmed. Again, the first thing we can do is better support victims, and anyone can do that. Your church can bring that person in for a meal. You can go over and check on them or make sure that they're getting up and getting to work in the morning, knowing that they're going through grieving, or, help them wash the car. Like, there's so much you can do to support those who have been through that traumatic incident, just to show them that there's love in the world and there's other people that care about them. And that goes a long way, because we're not doing that enough. And the government's not doing that. Our community and society is not doing that, but you could do that, right? And then if you want to get into bigger policy battles, you can always, follow organizations like ours, at Community Justice. And we'd love to have more and more voices to help us fight this fight. Absolutely.
And Dr. Brewer, is there anything, in our last few minutes that you'd like to add?
I kind of want to piggyback on what Greg has just said. It doesn't take a whole bunch of people. One person recognizing that he or she matters, what happened to them matters, and saying out loud that it happened, how it felt, and then talking to somebody else, acknowledging that they have value and whatever went wrong with them was not okay. One person can be so powerful. Greg, you talked about 5 people getting a whole bunch of money, and we don't think about that. We're always taught about what we can't do, and we have to recognize that what we can do, and one person is amazingly powerful.
Absolutely. And so, in closing, just a few of the things, that I've gained from this conversation is, one, as a community, we've got to hold space for one another because we can't depend on anyone else being able to do that for us. And sometimes what does that look like? It's just listening without the need to respond, sharing without the need to have a debate or to have to agree on everything, but to just acknowledge that we are all having a human experience here. And we come from different backgrounds and perspectives and experiences. And so we all have something to contribute. Another thing that I got from this conversation is when it comes to taking care of your therapeutic care, if there are resources available, use them. Find the professionals, talk to someone to begin to get those tools to figure out how we can respond. And then when we see that there are organizations like yours, Greg, in our communities who are willing to support us in being able to help ourselves and to prevent a number of these things and to be counselors and to hold space with one another, take advantage of it. If you can figure out how to bring organizations like that to your community, if there's a need, we definitely need and want to do that. And hey, write letters to our politicians. And if we can't write letters, then our feet vote. Walk to where you need to go and make sure that your physical presence is known and there because you matter. Your experience matters and it counts. And I think that's one of the biggest things is people feel like, who am I to make a difference? My voice doesn't matter. And the fact is it does. And then the collective power of all of us speaking together and collaborating. We've got to do this together because together we have to stand together in order to combat and stand up for ourselves. So I just want to thank both of you for this incredibly profound conversation today. Thank you all so much for just sharing your experiences, your contribution, and being able to provide us, some tangible solutions and some hope for tomorrow and hope for today. So I thank you all and thank you all for tuning in to this episode of Profound Conversations. I am your conductor, Nikita Lee, signing off. Thank you and join us for our next episode.